Welcome to Chiropractic Roots, the official podcast of the Kansas Chiropractic Association. Here we explore the stories, struggles, and successes of chiropractors across the Sunflower State. In each episode, we interview Kansas DCs to learn how their chiropractic journey began, how their practices took shape, and what lessons they've learned along the way. Whether you're a seasoned professional, a student, or simply chiropractic curious, you're in the right place to hear from the roots of the profession. I'm Dr. Travis Oller, Executive Director of the Kansas Chiropractic Association, the nation's first chiropractic association. Let's get adjusted. Our guest today is Dr. Scott Null. Dr. Null, welcome to Chiropractic Roots, and tell us a little bit about yourself.
Well, thank you, Travis. Well, um, my name's Scott Null, and I've been a chiropractor for going on 45 years since I graduated from Palmer in 1980. And I grew up in a chiropractic family. My father was a chiropractor, and of course, now I've got my son in with me. So it's a third generation of chiropractors in this same town. We just last year celebrated our 75th anniversary since my father started the office here in 1949.
So you're from Independence originally. I'm going to assume your first experience with chiropractic was early. Uh,
hmm Right.
what do you know
I can
about that?
remember, I can remember Randy Schmidt one time at a convention. A group of us were sitting around, and he said, "When did you get your first chiropractic adjustment?" And there were several doctors standing there, and a couple of them said they didn't even that they had got it when they were young or sports injury or something. But there were a few that didn't get a chiropractic adjustment until they were in chiropractic college, which I thought was a little strange. And when he came to me, I said, I don't remember my first chiropractic adjustment because I grew up with chiropractic, probably had it, you know, within days after I was born or the day I was born. And I remember growing up thinking when people would ask me what my father did, and I said he's a chiropractor, and they'd say, "What's that?" And I thought, wait a minute, doesn't everybody go to the chiropractor? So it was that was really interesting to find out that there were a lot of people that didn't that hadn't been adjusted forever, and I grew up that way. Um, I'm 68 years old. I've take no medications, no prescription medications of any kind. I've never taken an antibiotic in my life, and that's surprising to some people. But and then I can't remember the last time I missed work because I was sick. So growing up under chiropractic care is just I think is something that everybody should do, and I try to use myself as a instrument of teaching people that. So.
So you come from a family of chiropractors. When did you decide that's what you wanted to do?
And that's kind of interesting. I don't know. I think sometime in middle school. I have two older brothers, and they both went into journalism, and uh, I was never a journalistic major. I love science. I love math, and when I'd hear my dad tell stories about his patients and how well they did, and of course I was down in his office all the time, and I saw the people, and they would uh, talk about that quite a bit. Um, it just probably middle school age, I thought, that would be a good career. So I pretty much, once I thought of that in middle school, I just geared myself right towards that the rest of my schooling career. So,
Good. So I've asked this question of a lot of people, and I find the varied answers quite enlightening as far as how things are today. Do you remember how much you paid for chiropractic college?
yeah, when I started chiropractic college, the tuition was $725 a quarter. So that was, and you had 4 quarters in a year. So that's what it ran when Logan, my son, went through chiropractic college here, what, 7 years ago or so. I don't remember what his tuition is, but I was appalled at how how much it has gone up. So uh, I I put myself pretty much through chiropractic college and worked some part-time jobs, but I did borrow a little bit of money, and I thought I was so far in debt because I had borrowed $13,000 to finish chiropractic college, which I know for most students that would be a drop in the bucket today. So
Yeah, that's a trimester now,
yeah.
if we're
hmm
lucky. So did you immediately go back to Independence and work with your dad?
Well, when I got out of college, I had taken Oklahoma boards, and then I took Kansas board, and I took Colorado boards. You had to take each state at the time, and I thought, I'm not going back to that little dinky town I grew up in. I'm gonna. So I went and looked at a lot of different towns, especially in Colorado. I thought that would be a great place to go, and I had a Colorado license, and there were some interesting places that thought would be a good place to start up. But being fresh out of chiropractic college, I had no money, so I thought, well, I'll go back and work with my dad for a little while, and my little while has turned into 45 years. I actually went work with my dad, and there was Dr. Jim Brusso in Parsons, and he had just had surgery on his foot, and he had diabetes, and he was not in good shape, and he was wanting to get out of practice. So I went over there and bought out his practice and practiced in Parsons 3 days a week and in Independence 3 days a week. And I did that for 19 years, working 6 days a week before my dad retired. And then I just took over this office completely here. So,
That's a lot of work. So when you first went in with your dad and in that practice in Parsons even, can you
mhm.
tell me how you marketed the practice? How you marketed yourself?
Well, I didn't really market myself much because my dad had been established forever. And so we were just, uh, I look back and things, and I think we really didn't do much advertising because it was uh, more word of mouth, and it still is right now. We still don't do a whole lot of marketing, uh, just because we've been here for so long and everybody knows us around here and all the surrounding towns. Uh, so that's how we keep it going.
Okay. Did you have a mentor besides family early in your career?
No, I didn't. I don't really recall anybody else. Of course, I would ask my dad uh, things, and I'd say, "How do you know this?" And he'd say, "Because I've been doing it for 35 years." So uh, he was really my mentor, and I look at back at what he did, and it's. I always said if I could be half as good as him, I'd be successful. So,
Wonderful. Are you guys still in the same office that he practiced out of?
well, my father started at in a upstairs in a bank building here in town, and worked there for several years, and they basically were kicking them out. That was a whole like a professional building. They had dentists and medical doctors and accountants and everything, and um, and but they Arco Pipeline Company was headquarters here, and they were going to move. They wanted to move more, have need more office space, so they basically got rid of everybody out of the bank building, and and then so my father and an accountant built this office that we're in now. And then after I bought it from them, we remodeled and we're in the same building since 1969.
Wow, that's impressive. So
Mhm.
how did you can you compare working with your dad versus having your son now in the office? Any unique challenges or opportunities that
Uh,
you noticed from that?
I don't know. I wouldn't say there's a lot of challenges. It's great working for my son because I worked with my dad. I love doing that. And then after he retired and then passed away, I worked by myself for several years. I had a few associates off and on, but n nobody that stayed real long. And then when my son came in, of course, then he finished his uh, DCCJP degree, the Diplomat of the Chiropractic Cranial Cervical Junction Procedures. So seeing the stuff that has changed now, the information that they have out there now, the new technology, it's amazing to me. I just now wish I was 40 years younger. So,
So how do you approach building trust in patients and retention?
well, um, most of it's just what we work with when I try to tell the chiropractic story. My father always told me to uh, practice with your heart. And I think that was a good thing. I listened to your talk with Dr. Hazy, and he had interviewed my father for the KCA Journal one time, and I thought that was, very interesting that he went around and did that to several of these legend chiropractors, and now he gets interviewed with you again. So, uh, I- what was the question again? I guess I'm getting off track here.
How do you approach building patient trust and retention?
Oh. Yeah, just telling the chiropractic story, I think that's the biggest thing. Uh, Teaching people that I go through it a little different because I don't talk to people about symptoms. I mean, I tell them we'll use symptoms to see if we're, correcting things, but we don't treat symptoms. We treat the problem, we treat subluxations, and I really go into, I'm probably pretty old school chiropractic, of the listening to my dad tell me stories about BJ Palmer and stuff that uh, I try to teach people the meaning of chiropractic and why it's important to have your spine checked, whether you got symptoms or not. So, and that has helped. Of course, being in a small town, I see people on the street and they say, "Oh, I need to get in," and I said, "I'm in the same place." So they, so they, and then they'll come in that way. So,
That leads me right into the next question. How do
mhm.
you stay involved in your local community?
Well, I've been involved in a lot of things. Of course, I'm a member of the Optimist Club, so you meet people out that way. I've been on several boards in town for different things. Um, I teach a Sunday school class every week, and just being pretty active in the community. So I show up to a lot of the community events. We're a small community, maybe 9,000 people, 8 to 9,000 people now. We used to be about 12, and we are losing some population, but just being involved in the community with clubs and activities and the park board, Four Paws board, stuff like that, is what keeps me going. And I keep my very active in the Chamber of Commerce, so that keeps me out in front of a lot of people a lot of times. So,
Hmm. How do you maintain your work-life balance?
well, now that Logan's in here with me, I've cut down to now down to 3.5 days a week, which just seems like a lot of, seems like I'm not doing much compared to the 6 days a week that I did for years when I first started. Uh, the, I enjoy that, taking off a few extra days, a little bit of, uh, you know, afternoon times and stuff like that. It just, uh, I find out I still enjoy doing the work. I just had a class reunion, our 50th class reunion, and everybody said, "Are you still working? Why don't you retire?" And my best answer was, "I don't want to retire. That's the reason. I love this work so much, and watching people get better and restoring their health is just keeps me that part keeps me going. And so I don't want to quit completely, but it's nice to be able to take off. And if I want to take a longer vacation, we just take off at different times. So
What do you wish you knew when you first graduated?
say that again. What?
What do you wish you knew? What do you know now that you wish you knew when you
Oh.
first opened up?
Well, that's a good question. And because there's probably a lot of things I wish I knew. Uh, uh, there's so much things that have changed over the years. Going to um, continuing education conferences, and they'll talk about different things, and I think, man, where was that when I first started? So, uh, just understanding more of uh, the physiology of how the body works, and because I do orthospinalogy work, a lot of the information that's coming out now about the cranial cervical junction has really impressed me. So, in the brain and the glymphatic system, which wasn't even uh, what I guess they invented, wasn't even found when I graduated. And now we see things like that. So keeping up, that's one of the reasons I love going to continuing education is uh, I can remember when I first went to those classes through the KCA, there would be older doctors taking notes, and I'd say, "What is this? This is general knowledge because it's the stuff we just learned in class." And it wasn't too many years later that I sit there now and I take notes and I think, "Oh my gosh, this is so much more interesting now." So,
The pace of knowledge is amazing how fast new stuff
right,
comes out. And
right. Mhm.
yeah, good. Where kind of leads to the next question. You've been involved in chiropractic you've been in practice 45 years and involved much
Mhm.
longer than that through your family. Where do you think or hope chiropractic will go in the future?
Well, that's a good question, and I I would think that. one of the biggest things I look at it, I would hope that chiropractic, I look at the colleges and stuff, and I would hope that we would become more um, scientific and more getting the public, the general public, to understand what chiropractic is. And that's that's something I think that we're falling behind on, that we're, when I hear something that there's a new drug that may help Alzheimer's, and it's blasted across the media on everything and they say, yeah, this is preliminary studies. It won't be out for another 10 years or whatever. And to me, our national associations and our colleges should be putting out the stuff that uh, the research that we have about chiropractic, and it's not that uh, the things that I've seen over the years, and that it's not just for back pain or headaches or whatever, that we really have a lot more to offer the general public. And instead of seeing, which started out to be about 2 to 3% when I started, and now I guess they're up 7 to 9% or something of the population. Uh, you know, I think we ought to be seeing at least 50% of the population. So.
Yeah, definitely. You've kind of already touched on this, but I want to ask it directly. Do you have an exit strategy, a retirement plan, or do you plan on working life?
I don't have an exit plan really. I mean, we do basically, now that Logan's in with me. Uh, you know, I've we've discussed it. I've got other kids. I've got two other kids that are both engineers, so they're not into chiropractic work, and he did, and he came back here. So my exit strategy is basically I'm going to work for as long as I can, and then uh, if I don't sell it to him beforehand, he gets the practice. So maybe I shouldn't tell him. Yeah, he already knows all that work. So that's my exit plan, because I was worried about it. People kept asking me for years, what are we going to do when you retire? And I thought, I'm not. Do I look that bad? I'm not that old yet. Uh, so that's kind of my exit strategy. It's not really a big plan, but since uh, since he's in with me, that's kind of the easy way out. So we've got it set up that way that he gets it. So,
Yeah, that makes it much easier than trying to figure out how you're going to sell it
right,
or what you're going to do with
right.
it. So, yeah,
Hmm.
um, those are all the hard questions. I have just a couple of fun questions now.
Okay. Hmm.
What's something about you that patients might be surprised to learn?
Oh my, that that's a hard question to answer. Maybe I mean, I do a lot of things outside of the office. I'm very active, love to hike, love nature, uh, get out and do that. I've um gone canoeing in Canada, and did a lot of work with the Boy Scouts, hiked in the mountains of New Mexico. So that may be part of that. I do a lot of just little handyman and woodworking things. Um, build a lot of stuff, little things like that. So that may be, different than what a lot of people think of a doctor doing. So,
Okay, good answer. Last one. If you hadn't become a chiropractor, what do you think you would have done?
see, and that's a real hard question, because I've thought about that some, and because, like I said earlier, I think I was in middle school when I thought about being a chiropractor, and I went through that, became a chiropractor. I loved it, and I never looked back. So I can't really think that there would be anything else uh, that I would have loved to do more than this. Uh, there's some things that when I look at my practice over the years, the things that people get better, I you know, wish I'd written down some of these things of how almost miracle cases. But to me, they're not miracles, because they happen more often than what you think. So,
That is true. Um, just to let you know, though, if you need help, I got resources if you want to start writing papers. So
uh,
we can help you out, or we can find people to help you out with that.
we've got what Logan helped. He wanted to write up a paper when he was uh, in college, and he said, "You got an interesting case," and I thought of one, and we did write it up, and they actually wanted to. We had it published uh, on a young man that had a 19 years old and had a nail gun fall off a roof and hit him on the head, and he started having seizures after that. And he went through all of the, medical treatments, and it wasn't helping any. And he basically couldn't drive anymore. He couldn't work. He couldn't do anything. And uh, his aunt was a patient of mine, and she said, "Can you help him?" I said, "I have no idea." And he came down with his parents and was actually having. Uh, we had taken an X-ray, and he was actually having a seizure after that. And when we adjusted him, as soon as I did, his seizure went away. And it took us a few months, but they got less and less. And then, now he's married. He's got kids of his own. He stops in every once in a while when he's in this area and says hi to me. And it's, that's exciting to see some of that. So,
That's an amazing story. Thank you for telling it
mhm.
to us.
Yeah.
That's the end of my questions, Dr. Null. I
Mhm.
thank you for joining us today on Chiropractic Roots. But
Mhm.
before we end, is there anything that you would like to add?
Well, yeah, there are a few things. I would tell other students and everything, practice with your heart. My father told me that all the time. And if you're if you're in practice and it's a burden, then you're in the wrong business. And every day I get up and think, okay, who can I help today? And I look back at things. Logan would probably tell you that he grew up, uh, you know, under chiropractic care. And I can tell you a story about him when he was probably in middle school. uh, I went in to wake him up for school, and he said, "I don't feel good. I think I need to stay home." And I said, "Are you sick?" And I checked, he had no fever. I said, "Where do you hurt?" All that stuff. And he kept saying, "I just don't feel good." And I said, "Okay, you're going to have to get up and get dressed and come down to the office. I'll check you. I'll have you, stay down there with me." And he rolled his eyes and he said, "I'm not sick." But he said, "All my friends get to stay home when they're sick." He goes, "I never get sick, so I never get to stay home." And I thought, well, that's it. Get up, go to school. But he he complained about that for never being sick. And I thought, isn't that a good thing to want to be healthy all the time? So,
Well, thank you again, Dr. Null, for joining us today.
okay.
I
I
appreciate the time.
I appreciate this, and hopefully we can always, get other students uh, to love what they do and look for the people that where you can help. That's I say a little prayer every day to, you know, send me the people that I can help, something that I could do. So it's frustrating. That's the only time I have trouble sleeping is if I have a patient that's not responding the way we want them to. But most of the time, uh, I'll see somebody and they'll come in and we get them better. And it's just the most rewarding career I could ever think of ever having. So,
Great.
so I appreciate it, Travis. Thank you for having me.
Yeah, thank you. Have a great day. Thank you for tuning in to Chiropractic Roots, brought to you by the Kansas Chiropractic Association. If you enjoyed today's episode, be sure to subscribe, leave a review, and share it with a fellow chiropractor or student. To learn more about the KCA and our mission to support chiropractic in Kansas, visit kansaschiro.com. Until next time, stay grounded, stay growing, and keep adjusting.